This is the case of hypertrophic obstructive cardiomyopathy. In this image, you see right atrium, right ventricle, left atrium, left ventricle, and hypertrophied interventricular septum. SAM is also seen, and posteriorly directed moderate MR also seen, moderate mitral regurgitation. This image just see how the SAM happens. SAM means systolic anterior motion of anterior mitral leaflet. So after mitral valve closes, during the systole, it moves towards interventricular septum, causing subaortic dynamic obstruction. That is the point. So in this case, SAM is seen, significant subaortic dynamic flow obstruction. So whenever you see hypertrophied interventricular septum and SAM, most likely the case is HOCM, hypertrophic obstructive cardiomyopathy. Mostly it is idiopathic. Sometimes it's also seen in case of hypertensive case, old aged persons, anterior wall MI with vessel septal hypertrophy. So whenever you see the SAM, or we see the eccentric posterior MR, vessel septal hypertrophy, try to note hypertrophic obstructive cardiomyopathy. This is the case. You will see obstructive cardiomyopathy. SAM is again seen. SAM is clear cut. Mitral valve closes and then systole starts. During systole, anterior mitral leaflet touches just interventricular septum. Just see in this image, anterior mitral leaflet touches the interventricular septum. Touches. This touches. Close, and then touches. Just touched. So this type of image you have to see. This is SAM. So whenever you see the SAM, significant flow obstruction, that means HOCM. But little bit PML tip or PML is also classified. But see, just mitral closes, touches each other. Closes means touches each other, and then it moves anteriorly. In this image towards interventricular septum, causing flow obstruction in subaortic region. Flow obstruction is called dynamic because it varies with preload. During Valsalva maneuver, preload reduces, so obstruction becomes more. Similar things that depends on preload. Loading condition of heart, so it is dynamic in nature. Dynamic means it's changing. It's not constant. Gradient is not constant. With certain maneuver, when a patient is exercising, when heart rate is very high, during dehydration, obstruction becomes more. Now you see, SAM closes and then touches the IVS, interventricular septum. In this image, just see how it touches. That is SAM. You see the obstruction. Obstruction is quite significant. Then more than 5 meter per second obstruction. That is gradient 4 into 5 square, more than 100. So gradient in this case is, you see this image, gradient is very high as the velocity is very high. So in case of SAM, if significant flow obstruction is there, patient is symptomatic, syncope is present. You see this parasternal long axis view, how the anterior mitral after just systole touches the interventricular septum. You can see the thickness of IVS. IVS is quite thickened. Interventricular septum is much more thickened compared to posterior wall. Criteria wise, it has to be thickened at least 1.5 times, but in this case, it is thickened even more than 2 times. And you see this AML touching the interventricular septum. This is touched. AML is touching. That is SAM. Systolic anterior motion of intermetal plate, that means touching the interval septum. But it should touch in the closed position of mitral valve. Open position, everyone the valve is touching because it is open. But even after close it touches. Valve is not closed and touches, closed and touches, closed and touches. That is sham. Thank you.